Hi, my name's Ashley. I was diagnosed with IgA nephropathy, also known as IgAN. Over the past couple of years, I've moved around different cities and tried out different nephrologists, and I wasn't always 100% happy with the treatment plans that I was offered. I felt like I was following all the directions, all the medication regimens, and living a healthy lifestyle. But it was frustrating to see those lab values still be abnormal and to still not have great kidney function. It felt like I wasn't being heard out when I was asking for different options. So when I moved, I did a lot of research into different nephrologists. I really wanted someone who specialized in IgA nephropathy and could offer more treatment plans.
FILSPARI can cause serious side effects, including liver problems and harm to an unborn baby. Your doctor will check your liver before and during treatment. Do not take FILSPARI if you are pregnant or plan to become pregnant. Women who can become pregnant must use effective birth control before, during, and for 2 weeks after the last dose. Tell your doctor about all the medicines you take. Do not take FILSPARI if you are taking an angiotensin receptor blocker, endothelin receptor antagonist, or aliskiren. Other possible side effects include swelling, low blood pressure, dizziness, and changes in kidney function. Talk to your doctor about any symptoms or side effects you experience while taking FILSPARI.
Since starting FILSPARI, I've noticed a lot of improvements in my labs. I was able to decrease the proteinuria and keep it at that level. That's why I think it's really important to have a really good patient-doctor relationship where you feel like your doctor's hearing you out. I think it is always scary to switch medicine, so I think that's something that I can definitely acknowledge and relate to as a patient. But I would say that it is worth trying something different. It's what I did by switching to FILSPARI. Asking the right questions is the first step towards taking back control of your own health. Don't wait. Talk to your doctor to see what's possible.
What is FILSPARI? Sparsentan. FILSPARI is a prescription medicine used to slow kidney function decline in adults with a kidney disease called primary IgA nephropathy, IgAN, who are at risk for their disease getting worse. It is not known if FILSPARI is safe and effective in children with IgAN. Important safety information. What is the most important information I should know about FILSPARI? FILSPARI can cause serious side effects, including liver problems and birth defects. FILSPARI can cause changes in liver tests. Liver failure was not observed in people treated with FILSPARI in clinical studies, but some medicines that are like FILSPARI have caused liver failure. Your healthcare provider will do blood tests to check your liver before starting FILSPARI, and then every 3 months during treatment. Your healthcare provider may temporarily stop or permanently stop treatment with FILSPARI if you have changes in your liver tests. Stop taking FILSPARI and get medical help right away if you develop any of the following signs of liver problems during treatment with FILSPARI: nausea or vomiting, pain on the upper right side of your stomach area, tiredness, loss of appetite, yellowing of the skin or the whites of your eyes, jaundice, dark tea-colored urine, fever, or itching. Because of the risk for liver problems, FILSPARI is only available through a restricted access program called the FILSPARI Risk Evaluation and Mitigation Strategy, REMS. Before you begin treatment with FILSPARI, your healthcare prescriber will explain the FILSPARI REMS. You must read and agree to all the requirements of the FILSPARI REMS. FILSPARI can cause serious birth defects if taken during pregnancy. Patients should not be pregnant when they start taking FILSPARI, become pregnant during treatment, or for 2 weeks after stopping treatment. Patients who can become pregnant should have a negative pregnancy test before starting FILSPARI. Patients who can become pregnant should use effective birth control before starting treatment with FILSPARI, during treatment with FILSPARI, and for 2 weeks after stopping FILSPARI, because the medicine may still be in your body. Talk with your healthcare provider or gynecologist, a healthcare provider who specializes in reproduction, to find out about options for effective forms of birth control that you may use to prevent pregnancy during treatment with FILSPARI. If you decide that you want to change the form of birth control that you use, talk with your healthcare provider or gynecologist to be sure that you choose another effective form of birth control. Do not have unprotected sex. Talk to your healthcare provider or pharmacist right away if you have unprotected sex or if you think your birth control has failed. Your healthcare provider may talk with you about using emergency birth control. Tell your healthcare provider right away if you miss a menstrual period or think you may be pregnant. Who should not take FILSPARI? Do not take FILSPARI if you are pregnant, plan to become pregnant, or become pregnant during treatment with FILSPARI. FILSPARI may cause serious birth defects. Are taking an angiotensin receptor blocker, endothelin receptor antagonist, or aliskiren. Ask your healthcare provider or pharmacist if you are not sure if you take any of these medicines. Before taking FILSPARI, tell your healthcare provider about all of your medical conditions, including if you have liver problems, are pregnant or plan to become pregnant during FILSPARI treatment, or are breastfeeding or plan to breastfeed, as it is not known if FILSPARI passes into your breast milk. Do not breastfeed during FILSPARI treatment. Talk to your healthcare provider about the best way to feed your baby during FILSPARI treatment. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and grapefruit. FILSPARI and other medicines may affect each other and cause side effects. Do not start any new medicine until you check with your healthcare provider. Especially tell your healthcare provider if you take non-steroidal anti-inflammatory drugs, NSAIDs, potassium-containing medicines, potassium supplements, or salt substitutes containing potassium, blood pressure medicines. Ask your healthcare provider or pharmacist if you are not sure if you take one of these medicines. What are the possible side effects of FILSPARI? FILSPARI can cause serious side effects including liver problems. See, what is the most important information I should know about FILSPARI? Serious birth defects. C. What is the most important information I should know about FILSPARI? Low blood pressure. This is common during treatment with FILSPARI and can also be serious. Tell your healthcare provider if you feel dizzy, lightheaded, or faint. Stay hydrated during treatment with FILSPARI. Worsening of kidney function. This is common during treatment with FILSPARI and can also be serious. Your healthcare provider will check your kidney function during treatment with FILSPARI. Increased potassium in your blood. This is common during treatment with FILSPARI and can also be serious. Your healthcare provider will check your potassium blood level during treatment with FILSPARI. Fluid retention. FILSPARI can cause your body to hold too much water. Tell your healthcare provider right away if you have any unusual weight gain or swelling of your ankles or legs. The most common side effects of FILSPARI also include swelling of the hands, legs, ankles, and feet, peripheral edema, dizziness, and low red blood cells, anemia. Your healthcare provider may change your dose, temporarily stop or permanently stop FILSPARI treatment if you develop side effects. These are not all the possible side effects of FILSPARI. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Travere Therapeutics at 1-877-659-5518. For additional important safety information, including serious side effects, please see the medication guide.